afternoon, everyone. My name is Mary Beth Carroll, and I'm the Assistant Director of Student Affairs within our Office for Student Engagement and Practice at Michigan Public Health. Thank you so much for logging in today. It's great to see so many people take time out of their busy schedules to learn more about our great community. I'm so happy to be speaking with you this afternoon. Before we dive in, though, if you could let us know in the chat box that you can see me and that you can hear okay, that would be great. Thanks, and we'll get started in just a second. Awesome. Well, great. I'm glad that we've covered that so far. Today's session, as you heard, will be being recorded. So if you do have to pop out for class or for work or whatever it is, know that you will be able to view this live recording at the end of the session. So with that being said, I wanted to let you know that connecting with prospective students is one of my favorite parts of my jobs. So I look forward to answering your questions during this next little bit of time here today. My pronouns are she, her, and hers. So let's dive in. To kind of give you a preview as far as what today is going to look like, the first portion will be a formal presentation, and we'll truthfully go through a lot of information in a short amount of time. So please feel free to take notes. And like I said, the recording will be available to you. We also have logged in 3 of our current student admissions ambassadors who will be interacting with you in the chat box. And then I'm also joined by 2 of our admissions staff, Joyce and Levi, who will be facilitating some of the questions as well. After the formal presentation, we will then have our students introduce themselves and we'll take more questions. So please feel free to think of those questions. Feel free to put them in the chat as we go throughout or save them until the end, whatever works best for you. So this first photo is of my daughter, Vivian, and she is actually going to be 3 next Thursday. As you can see, she's gotten used to wearing a mask, and her shirt there says choose happy, and she is happy, at least in this moment. I'm sure that most of you know that small children can be pretty unpredictable, and I think in some ways, unpredictability really sums up 2020. Some of the questions that you have today may center around the COVID-19 pandemic and how specifically the School of Public Health and the University of Michigan have handled the pandemic. I want to assure you that from the onset of COVID-19, university and school leadership have made public health informed decisions to ensure that all of our students can continue to learn safely. We'll continue to keep the safety of our community at the forefront today, tomorrow, and really for as long as the pandemic is with us. The staff and faculty here at the School of Public Health, we want our students to feel engaged, connected, and a sense of belonging within our community. And we recognize that these are unprecedented times. It's really important to us that our students know that they're supported, whether they're joining us for in-person class or joining us virtually. We want them to know that we are a team here to support them through their educational pursuits. Now, when I speak to prospective students, I tell them that one of the main advantages of coming to the University of Michigan School of Public Health are the countless opportunities and resources and even networking engagements that you'll have access to. We encourage our current students to take advantage really of all that is around them. So know that we come to this conversation with that lens and that framework. If you have any follow-up questions with regards to that, please don't hesitate to ask. Now today's session is going to be primarily geared towards our Masters of Public Health and our Masters of Health Services Administration prospective students. So this next slide really addresses what is public health. And as you can see, we define it right here. Public health is the science and art of preventing disease, prolonging life, and promoting physical health and efficiency through organized community efforts. When I think of public health, I really realize that it really is all around us. It's the quality of the air we breathe. It's the flu shot that you may have gotten recently at the pharmacy. It's the ethics of genetic testing, and even the creation of the policies that govern our healthcare system. If you hear about something in the news, it's likely that there's some type of public health angle to it, especially right now. So really the common denominator is this. It's everything we do in public health is about improving the health of people, but at a population level. Michigan Public Health has been working since 1941 to pursue a healthier, more equitable world through education, research, and action. Included on this slide, you'll see a breakdown under the core areas of study of our different departments and programs that we have at the school. In addition to that, I'll note our Master of Health Informatics degree, which is a joint degree with the School of Information. To speak generally, when you apply to a Master's of Public Health program at the University of Michigan, you will apply to a specific department. We have applicants who do apply to multiple departments, and they have multiple interests. You would apply utilizing the common application, which is SOFIS, the common application that is used widely for schools of public health. In addition to that, there's no specific undergraduate degree or set of professional work experience that you have to apply. You can see some of the different backgrounds and majors that we get students from. So keep that in mind as well. When it comes to GPA, typically we are looking for a minimum of a 3.0 GPA, and on average admitted students are between a 3.3 and a 3.5, but we'll talk more about that later. If you do have specific questions regarding your specific situation today, please email our admissions team. I will have Joyce or Levi put that email address in the chat box there. It is sph-inquiries@umich.edu, and we can walk you through your specific question. So let's move on here. Going back a little bit about some of the different opportunities at the University of Michigan, I want to just touch on the various different career opportunities that public health can get you. We have a very devoted careers team who helps our students secure full-time employment. They help with salary negotiations. They actually host weekly office hours on Wednesdays and Friday afternoons where you can go and just pop in and have your resume review or get advice with regards to an upcoming interview or something like that. We also have a staff member who is specifically dedicated towards strengthening relationships with outside companies, an employer relations coordinator who regularly has companies come in and visit the school, and obviously they're hosting those instances virtually right now. Our careers team surveys graduates 6 months out from graduation, and 98% of them have full-time employment within 6 months of graduating. Just to highlight a couple of our recent employment sectors, they would be hospital and healthcare providers, academia, consulting, and private industry. So this slide here, you can see a beautiful picture of Ann Arbor. If you haven't visited us, you know, use your best judgment in terms of visiting us at this point, but do whatever you can to get that experience without necessarily coming to Ann Arbor. I encourage you fully to dive deep into an investigation to see if the University of Michigan in Ann Arbor is the right fit for you. It really needs to be a mutual decision that works best for both parties. So always remember that as well. Continue to take advantage of opportunities like this to engage with current students and staff. I posted in the chat box earlier some information about our prospective graduate student discovery series. Joyce or Levi, if one of you could refresh that so that people can see it. If you haven't signed up for this opportunity, it's going on right now. And essentially what it is it's a large virtual open house that's department specific, where you can go and log in and talk with the admissions chair, talk with the recruitment chair, and get a deep dive with regards to what the department has to offer. So we are doing our best to put together virtual offerings for our students. So please don't hesitate to reach out if you feel as though something is missing or you have questions that you don't feel like are getting answered. So this next slide dives a little bit deeper with regard to Michigan Public Health and what our school really looks like. I think it's important to be somewhat familiar about some of the numbers associated with our community. So there are about 1,300 current public health students. This includes graduate, residential, and online, as well as a undergraduate population as well. We have around 170 faculty, and if you are interested in research, we have 34 research centers. One of the differentiators, I think, of our school really is that as a graduate, you become part of one of the world's largest alumni networks. Our faculty to student ratio is 9:1, and I think a lot of times when people think of the University of Michigan, they think about a large public research institution, which we are, and that they would be, you know, just a number lost among the mix. But we really strive to support students really from all angles. As a public health student, you'll have access to support services at the University of Michigan level, the school level, and then even within your department. You'll also be assigned a faculty advisor who will help you navigate throughout your program as well. So this next slide breaks down the different degree programs that we have at the school. First, I'll draw your attention to the degrees listed under professional. And there you can see our Masters of Public Health and our Masters of Health Services Administration. The Masters of Health Services Administration is administered through our Health Management and Policy Department, and it's very similar to an MBA program. We also have students within that department who move freely between the MPH and the MHSA. So if you are an applicant to one of those programs, please feel free to ask us any questions about that. With regard to the Masters of Public Health, we have a residential program that takes place in Ann Arbor, and that's designed to be about 2 years and 60 credits. And then we have a new online program as well that's fully online. It takes about 20 months to complete and 42 credits. So very excited to have that program on board and to reach students that we normally wouldn't reach. If you are interested more in research, we have an online MS program that just launched this year as well, and we have our Doctor of Philosophy programs too. Those are administered jointly by our departments as well as the Rackham Graduate School. At the forefront of the University of Michigan is the interdisciplinary nature of the university, and that you have top scholars and top faculty within any discipline, honestly, you can really think about. The university is made up of 19 schools and colleges, and as a public health student, you can actually take courses at any of those schools. So that's something that you should keep in mind as well. We recognize, as I said, that public health is such a diverse field. You're going to have interest in other areas, and being able to already have that built into the curriculum is a true benefit to coming to the University of Michigan. As a university, we have over 97 graduate programs ranked top 10 in the country, and that ability, again, to learn from leaders within other fields is huge. As you can see listed here, we have a set of formalized dual degree programs. Students interested in applying to a dual degree program will apply to both schools at the same time and separately as a normal applicant. And then if you were to be admitted to both, you would start those programs. If you are admitted to both, then you would be able to complete, again, those 2 master's degrees within 3 years. So this next slide talks a little bit about some of the application requirements. Hopefully, if you're applying for fall 2021, these aren't completely foreign to you yet. Again, as I mentioned, the SOFIS application is a common application for schools of public health. It allows you to apply to multiple schools. So that's one of the big benefits of this application system. So we do have some required statements and essays. The one thing that I want to make sure that I draw your attention to would be the fact that we are not requiring standardized tests for fall 2021. So in lieu of that, we have a quantitative experiences statement. You can, again, review all of these prompts on the website, but I do want to just say what that is for those of you logged in today. With the quantitative experiences statement, we're looking for a couple things. The first would be referencing key grades that you received in science and math courses. And then secondly, talking about specific research or work experience that you've had that involves quantitative and analytical tasks. So again, that is in lieu of the standardized test requirement. So if you do have further questions about that, let us know. On the application, it is a free form, so there's no limit. We're really just looking for content, probably a paragraph that summarizes that type of experience. So anything that you think would be helpful to the review committee with regards to quantitative experiences, put that in that essay. We also require 3 letters of recommendation, looking for ideally academic references, and then when thinking about professional, thinking about a mentor or a boss or somebody who can speak to you being, you know, characteristically equipped and able to handle a graduate program. When teeing up your recommenders, make sure that you give them ample time. In addition to that, talk to them about what public health is. I would also encourage you to give them a copy of your resume. all those things will set them up for success. And first and foremost, make sure that when you are having those conversations that you're asking them if they can write you a good letter of recommendation. With regards to the essays, the first one there, the statement of purpose, is the longer of the two, addressing things such as why Michigan Public Health and talking about your future goals and aspirations is what we would like you to do. We really encourage you to have your voice come through within that piece and your passion. It's one area where we want to really hear that drive and that willingness to provide public health service to the community and to the world. For the reflective essay, the shorter of the two, there are a couple things within that. One, what specific characteristics or experiences do you have that can contribute to our diverse student population? And then secondly, if there are areas of the application that you're concerned about, make sure to address those within that piece. So this next slide really is just to get you thinking a little bit about some of the background that you have and your experiences, making sure again that you put together a comprehensive application that depicts a total picture of what you really achieved. Thinking about things like research, professional experience, service, and volunteer work. Make sure that you put that in your essay and then within the application as well. So this next slide talks a little bit about where we're at in the review. And after you submit your application, you're probably wondering how is my application going to be reviewed? So you can see listed here all of the different facets of your application. And I want to share with you that all components are taken into consideration and that there isn't one thing that's going to make or break your application. I know it's hard not to focus on one piece. But faculty reviewers are really looking for the total package. Your application will be reviewed by at least 2 faculty review members, and it will be looked at from a holistic review lens. We use that lens when making all graduate student admission decisions, and truly a holistic review ensures that not one single factor either leads to accepting or excluding a student from admission. So one thing we want to be sure that you're aware of. This next slide here depicts a little bit more about the timeline with regard to our applications. At this point, all of our applications are open for fall 2021. Our priority deadline is coming up on December 1st. For the online program, the priority deadline would be February 15th, as you can see noted there, and then a hard deadline for all international applicants, which is January 15th. If you are interested in an MS or PhD program, we encourage you to refer to the Rackham Graduate School website for more information about some of those application requirements. So please don't hesitate to reach out if you have questions about that. In addition, the hard deadline is going to be June 15th. One other thing that I just want to make clear that I mentioned a little bit earlier, if we have people logging in and out, the standardized test for all programs for fall 2021 has been suspended. So there's no standardized test requirement for fall 2021 applicants, again, for all degree programs. So if that's not clear, feel free to type in the chat box. Please let us know if you have questions. So this next slide here talks about funding, and of course we recognize that cost plays a huge factor in your decision-making process. So first and foremost, we encourage all applicants to complete the FAFSA form. Please know that if you do have a complete application, again by that priority deadline being December 1st, you will be automatically considered for our Dean scholarships. There is no separate application needed. Once you're admitted, then you're typically evaluated for that type of funding, and you will receive 2 separate communications, one with an admission decision and one with the funding. So be aware of that as well. In addition, as you are completing your SOFIS application, please note that the email address you're using will be the one that's officially used for all communications. Be sure to keep a pulse on that so that you can continue to see how your application goes through the review process. About 35% of our students receive an award, and we, as a school, give out around $4 million in aid each year. There are quite a few other ways in which students can secure funding. Some of those are listed on our website. The University of Michigan also has quite a few graduate student research assistant positions, graduate student instructor positions, and typically students apply for that type of role after they're admitted. So at this point, I'm going to stop. I know we are running up a little bit on time, but I want to make sure that our featured guests of our 3 current student admissions ambassadors are able to talk too. So at this time, if the 3 of you wouldn't mind turning on your camera, we'll have all of them introduce themselves. They'll say their name, their year, the department that they're in, and then their undergrad degree and institution. Andrea, would you like to start?
Yeah, sure. My name is Andrea McGowan, and I'm a second-year MPH student, and I'm in the Nutritional Sciences department. My pronouns are she, hers, and her, and my undergrad institution is Emory University in Atlanta, Georgia. I'm excited to answer some questions that you guys might have today.
Hi, my name's Dave Coble. I'm from the Department of Health Behavior Health Education. I'm working on an MPH, and my undergrad institution is Central Michigan University, where I got degrees in biology and chemistry education.
Hi everyone, my name is Amb. I go by she, hers, and hers pronoun. I'm currently a first-year student of Master of Public Health in Nutritional Science with dietetic concentration. And my undergrad degree, I did an anthropology and nutrition from University of Washington, Seattle. Nice to meet you all.
Great. Well, thank you all for joining us today. If you do have any questions for our current students, please feel free to put those in the chat box at this time. In addition, I just want to reiterate that if you do have specific questions related to your situation as an applicant, we would encourage you to email our admissions and recruitment team at sph-inquiries@umich.edu. At this point, while we wait for some questions to come in, why don't I pose a question to our current students? That would be, what advice do you have for those who are in the application process?
Yeah, that's a great question. I think my biggest piece of advice is to really reflect on what you're looking to get out of a program and apply that to each school that you're looking into. That's something that helped me a lot in making my decision about, 1, where I applied, and 2, where I ended up attending.
Similar to that, I would say definitely consider where you want to be in a few years and the type of work you want to be posed to be able to do. And that's going to help you write a significantly stronger letter, but also help you decide whether it's the correct fit and what you want to do in your time at Michigan.
I have like a similar thoughts on that too, because the way that I put my mind, like when I did the personal statement and all the applications, I think what can I contribute to the University of Michigan, and also like what would I get from University of Michigan and also the department itself. So once like you can connect like these two things together, then I think like you can like have like a narrower mind and like more clearer thought of what you want to get like ultimately, like, and what would be your ultimate goal from getting this degree.
Also, one other thing, if you are unsure like what you're looking for specifically in a program, because it's hard to know, I think talking to professors and students that are currently at the program is super helpful, even before you apply. I did that for a couple schools, and it was really influential in my decisions.
Great, thank you. I see a couple questions here that I just kind of want to help with. So with regards to the question about scholarships for online students, yes, we do have funding available for our online MPH and MS programs. In addition, I see a question with regards to the executive master's program. Obviously, when it comes to those letters of recommendation, it's going to be a little bit different. If you have been out from school and you have significant professional work experience, then obviously you would be using more of a professional reference, and that would be okay. So another question that I wanted to ask our current student ambassadors would be, what do you like best about Michigan Public Health?
For me, I think it's the willingness for faculty and researchers to help students. In my previous school, I felt like that wasn't as strong. And so here at Michigan, I've been fortunate to have pretty strong relationships with my teachers and the advisors that I have. And they're always so willing to go to bat for me and help me find different resources on campus and that kind of thing, which I was super impressed with my experience thus far.
I would say my favorite thing is the peer groups here are really strong. And so when you're working in such small class sizes, the high level of discussion and people willing to push themselves on things like group projects it just makes the experience so much more enriching.
So for me, I think the support both from the university itself, the department, and also like the School of Public Health is very strong. Since I'm the first year student this year, and due to the pandemic and everything is like very unique. But I also feel that I get a lot of support in order to achieve my goal from obtaining this degree. Like even though everything is online, like they have like very diverse and a lot of opportunities for you to engage to both the students, the faculties, and also like ways to communicate with the professor of what to do both inside and outside of schools. So there's like the resource is really straightforward, and you can reach out to anyone, and everyone would be really willing to help you with that.
I see a comment here in the chat box with regards to just classroom, taking classes in general, as well as even curriculum details. So if you are interested in taking a peek at some of the classes and seeing a little bit closer in terms of what those descriptions look like, please refer to our website. You can see a breakdown within each of our departments. But on that topic, what thoughts do you all have with regards to access to faculty, support services, even just in terms of what most of the coursework looks like? Is it exams? Is it papers? Obviously, it varies on what it is that you're doing, the semester, all of those things. But if you could just talk a little bit in general, I think that might be helpful for our current students, our prospective students, rather.
So in the Department of Health, Behavioral Health Education, a lot of courses are like semester-long experiential projects. That's kind of the big focus. With that, also quite a few papers. And not too many exams. I think I've only taken like 5 or 6 exams in the School of Public Health since I've been here. So mostly projects where oftentimes you're partnering with some sort of community agency.
For the nutrition science department, I would say because some of our classes are pretty science-based, if you're in the dietetics track, we do have a fair amount of exams, not too much, but a lot of my classes do have exams, and then a lot of them have different assignments or essay kind of based assignments. And in terms of how you can access professors and how they make themselves accessible, every class that I've been in since the start of my program has had very flexible open student hours and office hours to meet with the professors that you might have for a particular class. And I've also reached out to different professors, and I've never not received an email back, even if I have no connection with them, or maybe they're even in a different school, like in the psychology graduate program, and I've never not received an email back.
So I would just talk adding to Andrea, since like we have like the same, we were in the same program, but for these years, I have like a really positive experience on the classes. We have like different kinds of the setting, like for instance, like some of the class would be more interactive in the way that like we choose like the assignment to do and which ones not to do, and we're just adding up to the points to get the grade. And some of the rest would be just like a general and really traditional way of learning. But overall, like even the professor will also support the students for creating a study group for the students and ask if we want to join, and then that would really help us to connect with the students and stuff together.
Great, thank you. I saw a couple questions. So Levi, if you could put in the chat box the link to the career outcomes. As I said during the presentation, our careers team surveys our graduates 6 months out from graduating. And on these documents, by breakdown of department, actually, you can see the starting salary, you can see sectors they're working in, companies they're working for. So that is something that I definitely encourage you to take a look at. In addition, I mentioned the priority deadline coming up, which is December 1st. With that being said, if your application is complete, you will be considered for our scholarships. And with that being said, there's not a separate application that's required for that. I also saw a question with regards to the hard deadline. That would be the last date in which we would take applications for fall 2021. That is June 15th. So hopefully that helps clear up that. If you are in your senior year of finishing your undergraduate degree, please know that you can go ahead and submit at any time. And if you are admitted, that would be on the condition that you provide final transcripts stating that you've had an undergraduate degree conferred at a institution. So hopefully that helps with that as well. In terms of other questions for our current students today, what is maybe something that you wish you could tell your former self about the application process?
I guess I would say, like, trust the process and be patient, especially with such a strange application year. I know that it's easy and there's a lot of crazy things going on in our world, but I think that in most academic programs, you tend to end up where you're supposed to be. And so take some confidence in that thought.
Yeah, I'd basically just elevate that statement. Trust it. Take the whole thing seriously, because they're gonna be looking at all of it.
I would say for more of like the encouragement, because I think don't doubt yourself that you are not enough when you're, especially when you're doing like your personal statements, because I was at that point before that I felt like my experiences, like my volunteer work or whatever, like activities that I've done, like it's not like enough to be like a competitive, like to be a competitive candidate. But don't think that you are like never enough, or just trying to contribute or like tell them about what you think would be relevant to both you and the program and the whole like community. Yeah, it might sound a little bit like, you know, cheesy, but it actually is actually true. Like, trust in the system, as Andrea and Dave said, and also trust in yourself of what you can contribute to it, and just tell them. Mm-hmm.
Great. Well, thank you all for your input, and thanks to all of you who took time out of your schedules to attend and learn more about the University of Michigan School of Public Health this afternoon. Up here on your screen is contact information of important people who you can reach out to if you have any questions with regards to the application process. Thank you again to our current student admissions ambassadors. We will be sending a follow-up communication after today's session, so be on the lookout for that. We hope you have a good rest of the day and a great weekend, and take care and be safe. Thank you. Bye-bye.